Well, black Americans are almost 3 times more likely than white Americans to die of COVID-19, Mel.
That's right, but fewer than half of black Americans say they would take the coronavirus vaccine once it's available to them. Joining us today to talk about the distrust black Americans have in the medical community in general and of the vaccine specifically is Dr. Timothy Quinn of Quinn Family Healthcare in Ridgeland. Dr. Quinn, as always, thank you for joining us this afternoon.
Hey, thank you for having me.
I've got some numbers for you. 63% of Hispanic Americans and 61% of white Americans say they would get the coronavirus vaccine, compared to fewer than half of black Americans. Why is this?
Well, I'm quoting an article from the Washington Post that was recently released. Actually, my daughter sent it to me last night. But basically in this article, it talks about decades of skepticism, decades of distrust. And in this article, it goes on to elaborate a lot of the problem is there's been a less than optimal history. And it's no secret that a lot of African Americans, a lot of people in my community, they don't see as many African American healthcare providers. And in a lot of cases, African Americans have had bad experiences in the past, and what the NIH, the CDC, and other organizations are actively engaged in is a very robust campaign to try to increase the trust in the medical community, especially with this African American population, which in this article has been quoted as having 3 times the chance of dying from COVID-19, and that's why this message is so important right now.
Dr. Quinn, what are you doing to tell your clientele, your African-American clientele, what are you telling them about the virus and the safety of it?
Well, what I'm doing is I'm working very hard to educate the patients that I see, the people that I talk to day to day, some of the forums that I participate in, just really trying to get that message out there that the vaccine is safe. The bottom line is there's a lot of information that's going around. Some of it's true, some of it's not. But what I try to do is really emphasize the true information. And one of the main concerns is this vaccine was developed too fast. It was rushed. They didn't go through all the necessary protocols for safety. And what I do is I reassure them, but I also educate them that a big part of the reason that the vaccine was able to go through so fast is because they used new technology. And I compare it to my cell phone. I mean, 6 years ago or 5 years ago, my cell phone was not as fast as it is now, but there's new technology that has been employed with messenger RNA technology with these vaccines, and it made it so that the manufacturers were able to bypass some of the steps that were unnecessary with this new technology and get the vaccine produced. And with the FDA, because of the pandemic and people losing their lives, well, they really jumped in and did what they needed to do and didn't drag their feet. And basically that's how we got it so fast, because during desperate times, actions were increased and we were able to get that vaccine done, and safety was on the top priority list during the manufacturing and all the certification. So I just reassure people, but I give them that information.
That's good. That's excellent. And I hope that I know you're getting the word out, and I hope that all the physicians out there, Dr. Dobbs saying today that really don't listen to Facebook, don't listen to social media or read all of that. Go to your physician, go to your doctor and ask them what they think. All right. Thank you so much again for being with us.
Hey, thank you.
With that speed fear, that is a colorless fear too. That's something that we all have to overcome.